How to get pregnant with Clomid versus Letrozole. Today, I'll be discussing two common medications used to enhance fertility, Clomid and Letrozole. If you're struggling with infertility and considering these medications, then this video is for you. I'll talk about how Clomid and Letrozole work, their potential side effects, and the factors to consider when deciding which one may be right for you. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I am a fertility physician and my channel focuses on everything fertility and women's health. If this is the kind of content you're interested in, keep watching. Let's start by understanding Clomid. Clomid, also known as clomiphene citrate, is an oral medication commonly prescribed to induce ovulation in women who have difficulty conceiving. It works by acting on the brain and tricking the brain to think that estrogen is low. This will now tell the brain to release more follicle-stimulating hormone called FSH. This hormone will then send a message to the ovaries to produce more follicles and grow big enough to release a mature egg. If the woman doesn't ovulate on a normal day or she has irregular cycles, it will help her to ovulate. If it is a woman that has regular cycles, Clomid may cause her ovaries to release more than one egg, and this can lead to twins, triplets, and so on. Now let's talk about Letrozole. Letrozole is another medication used to stimulate ovulation. Unlike Clomid, which acts on the brain, Letrozole affects the production of a hormone called estrogen. By reducing the estrogen levels, Letrozole encourages the release of hormones called FSH, which is follicle-stimulating hormone, which leads to ovulation. Same with Clomid. If the woman has irregular cycles, Letrozole will help to induce ovulation. And if she has regular cycles, it could lead to release of more than one egg. Both Clomid and Letrozole have the same goal of inducing ovulation, that is, to cause the release of eggs from the ovaries. But there are some differences to consider. Clomid has been used for a longer time and has a more extensive research history. It is generally prescribed for women with irregular or absent ovulation. Letrozole, on the other hand, has emerged as an alternative option and may be preferred for women with polycystic ovarian syndrome, that is PCOS, due to its potential benefits in reducing the risk of multiple pregnancies. When deciding between Clomid and Letrozole, you should think about several factors. This includes your medical history, any underlying conditions such as PCOS, and your doctor's recommendation. Your doctor will consider these factors along with your individual responses to the medications when determining the most suitable option for you. Let's address the success rates. The success of Clomid and Letrozole in achieving pregnancy varies from person to person. Research suggests that both medications have comparable success rates, with ovulation and pregnancy rates ranging from 60 to 80%. It is important to keep in mind that success rates can be influenced by various factors such as age, overall health, and the presence of other fertility issues. Like any medication, Clomid and Letrozole can have side effects. Common side effects of Clomid include multiple pregnancy. For some women, Clomid causes the release of more than one egg from their ovaries. If all the eggs fertilize, it can cause 2 or 3 babies, depending on how many eggs were released and how many eggs were fertilized. Some women love these side effects. A few women do not. Also, while on Clomid, some women may experience hot flashes. Hot flashes is simply when you suddenly feel warm or hot, and it's usually more intense over the face area, the neck, the chest, with profuse sweating. Some women may experience mood swings, that is, you start getting irritable, your mood starts to change very easily. Some women, it's breast tenderness that they complain about. Some women, there's changes in their cervical mucus, like dry vaginal mucus, that some women would experience reduced vaginal mucus while on Clomid. And for some women, blood vision or double vision. When Clomid is abused, That is, when it is used consecutively every month for a long period of time, or when used in very high doses, it can cause something called ovarian hyperstimulation syndrome, popularly referred to as OHSS. This usually occurs when your ovaries have overresponded to the excess hormones as a result of the Clomid. It causes the ovaries to swell and become painful. The woman will now feel bloated, and it can cause the feeling of vomiting, and some other women actually throw up. Complications of OHSS includes accumulation of fluid in the abdomen. Some women may even end up in the ICU, intensive care unit, because they can't even breathe well at some point. OHSS is not common with Clomid use, but it's important that I mention it because although it's rare, it can occur. Letrozole may cause similar side effects along with potential joint or muscle pain. It's important to note that side effects can vary from person to person, and not everyone will experience them. If you experience a severe side effect, it is best to stop taking the drug. Regardless of which medication you and your doctor chooses, it's necessary to emphasize the importance of medical supervision throughout the process. So don't just walk into a pharmacy and go and get Clomid. You need medical supervision. Regular monitoring through ultrasound scan, blood tests, and close communication with your doctor will help to ensure that the medications are working effectively, and it will also reduce any potential risk. Women who have blocked fallopian tubes cannot use Clomid or Letrozole because these drugs cause ovulation. That is, they cause the release of eggs from the ovaries into the fallopian tube. So if your tubes are blocked, the semen will not be able to swim into the tubes to reach the egg. So these medications are not appropriate for women with blocked tubes. Clomid and Letrozole are commonly prescribed medications that can assist in ovulation, induction, and enhance fertility. While they have similarities and differences, the choice between the two should be made in consultation with your doctor. I can't overemphasize this because your doctor is the one that will evaluate your unique circumstance. Remember, fertility treatments can be complex, and personalized medical guidance is key. As usual, I'm wishing you all the best on your fertility journey. If you found this video informative and you want more content like this, like this video, subscribe to my channel, share with your friends, and see you in my next video.